known as a road warrior. So I was traveling almost every week with Cerner, traveling around the country, doing a mixture of sales and marketing and consulting. So that was really neat for me because I had never been in the business world. And to see firsthand the competitive landscape at that time, you know, Epic was just arising. They were kind of a small company, but boy, they hit the market with like a storm in those years. I was with Cerner for 5 years. So those of you that are thinking about, you know, what are you going to do when you get this degree? You know, I would certainly recommend that you look at all of these companies. Maybe not Cerner or Epic, but certainly there are consulting companies that have a niche of healthcare IT that would be a great entry point for you. So I really enjoyed that. Learned a lot about the Cerner product and learned peripherally about what Epic was offering or what McKesson was offering or Philips or GE, etc., because we had to know about the competitors' project in order to, or competitors' products in order to discuss what Cerner was doing. So also part of that job was to give feedback to associates at Cerner about, all right, you're a doctor, you've got an IT degree, what do we need to do to keep tweaking this and to keep bringing on improvements? So that was another nice component of it. Well, because I lived in Houston and because Memorial Hermann is a client of Cerner, I eventually got to be in attendance to several meetings between Cerner and Memorial Hermann. And it just so happened that our campus here at the Texas Medical Center was facing a major upgrade in their use of the Cerner product. So Memorial Hermann decided to create a new position specific to our Texas Medical Center campus. And that position was the one that I applied for and that I currently have as Director of Medical Informatics. So let me tell you about how Memorial Hermann is set up, because there are a lot of opportunities with healthcare systems, and I'm sure my colleagues will give you their perspective. So Memorial Hermann has 11 hospitals in the Houston metro. We have one doctor who is our chief medical information officer. That's Dr. Bob Murphy. So he has kind of strategic responsibility for what we do across all of the campuses. Our campus here in the medical center is kind of special because it's the academic teaching hospital for the UT Medical School. And our campus really isn't just one hospital. We consider it to be like four. We have the adult hospital, the children's hospital, the Heart and Vascular Institute, and the rehab tier hospital. So the administration was seeing all of this change coming to this campus in terms of getting the physicians on board and happy with using electronic order entry. And they saw a need to have somebody that could be the interface between the clinical staff and the technical staff to make that project a success. So I was very lucky to be at the right place at the right time. Frankly, having the background in industry with Cerner was a big help. Having the professional credential of the master's degree here was a big help. And it was a great career move for me. And we have had a fair amount of success so far. We've, in the last year, taken all of our adult services to be using physician order entry, and now we're focused on the Children's Hospital. Our go-live date for the order entry, or CPOE for Children's, is in August. So we're doing a tremendous amount of work there with dose range checking, with dose normalization, with TPN orders. So there are just dozens of projects that someone with an informatics degree can be useful in the industry. Now, I will tell you something that Jaiji may not like to hear, because I have observed on our team who are the main informaticists on our team at Memorial Hermann. And you know what? They're nurses. Nurses that have a lot of experience with patient workflow and clinical workflow, and nurses who have volunteered to do a project here and there that has to do with IT. And then we see that a particular nurse has had kind of a knack for it, even without any formalized training. So my advice to you who are students is don't expect to come out and be the CMIO or the CIO. You know, you've got to take that entry-level job, whatever it is, with a hospital, vendor, consultant organization, and you know, get your foot in the door, leveraging all your skills, not just the degree that you're going to graduate with here on, is it Thursday? Is that the graduation? Yeah. And I think have an open mind about, well, I want to be the CMIO. Well, set that maybe out of reach, but not out of sight. You know, when you get your sheepskin on Thursday, you know, look around for that job that's going to, you know, it may not be the highest level that you want, but it's going to open up so many opportunities for you. So that's my advice, and a little perspective on my career. I didn't really expect when I came out of medical school that I would get into informatics, but boy, what an exciting time to be in it, and I wish you all as much fun and excitement as I've had so far. Thank you.
Thank you, Dr. McInnes. We're glad that you make good use of our education here and help with your career in serving constituents and make Texas bigger and better, and also use your education to serve private sector such as Cerner and also public sector as a memorial. And we're so proud of your accomplishment. Thank you. Now, next up, second in line, top of the line, is Dr. John Frazel. And Dr. Frazel worked for MD Anderson. So, please take it away. Please.
Thank you. So I graduated in 2002. I'm an anesthesiologist by training. I was in private practice before I came to the program here over at Methodist. I had an opportunity. I was in private practice. I sold my practice, took the buyout offer, and then decided to do something different with my life. The practice of medicine was fun. Anesthesiology was a great profession for me, and I really enjoyed it, but I knew I wanted to do something else and do something more. With anesthesiology, you touch one patient at a time. A good anesthesiologist could probably alter the life course of an individual of probably 2,500 to 3,000 individuals a year. I wanted to do more than that. And when I looked around the landscape, you have to understand, it was 2000, it was the internet bubble, you know, all of a sudden it was clicks and eyeballs and all that other sort of stuff that was making headlines. And I really liked computers, I really enjoyed information technology, but I saw in private practice that there was really a dearth of it. In our operating rooms, we were charting on paper like Cushing charted in 1930s. Really nothing had changed, although the technology of what you're charting, like end-tidal CO2 and stuff like that, the actual systems for recording it hadn't. And so I felt like that was a chance in that limited scope to be able to take and move information technology and really change people's lives. And so I came to the School of Health Information Sciences with the idea that I would have some sort of impact around patient care, probably in the operating room. And I can tell you that didn't happen. One of the keystones that I found about most people that go into informatics is that if your life has been a series of linear progressions, when you get into this field, be prepared to make step function changes in your life. In other words, it is not going to be a set of linear steps. It is going to be moving all over the place if your career is going to advance and if you're going to maximize your impact on healthcare. And so with my own, when I finished my degree here, and it was called the School of Health Information Sciences at that time, I started a consulting company and did health information security consulting, and I also wrote a book, Management of Health Information Technology, and taught some classes and supported myself like that for about a year and a half. My wife said, look, you're a board-certified anesthesiologist, you need to go back and use that degree or lose it. And so I looked around for an organization that I could use both my health informatics have the possibility of using my health informatics and being able to practice anesthesia, and that's where I ended up at MD Anderson. When I got to MD Anderson,